Hello and welcome everyone. I'm Marcus Escovedo. I'm Vice President of Communications and a Senior Program Officer at the John A. Hartford Foundation. We are a private, nonprofit, national philanthropy based in New York City, and we are dedicated to improving the care of older adults. Thank you so much for joining today. We're here to highlight results from a new national survey meeting the growing demand for age-friendly care, healthcare at the crossroads. This report was released last week by us and AgeWave, the nation's foremost thought leader on issues related to an aging population. And the survey was conducted by the Harris Poll, a well-known global public opinion research firm. We'll hear today recommendations to address challenges older adults are facing. And a main takeaway is that older adults were so clear in calling for care that is age-friendly and focused on what matters to us as we age. Before we dive in, just a few programmatic notes. We are going to have plenty of time for Q&A and do want to have a conversation with you. So please add your questions into the Q&A box located at the bottom of your Zoom window. A recording of today's discussion will be shared with you in a follow-up email, along with resources mentioned by our experts that you'll hear today. We'll also share a link to a brief survey about today's event, and we appreciate you completing that when you sign off today. Now I'm delighted to introduce you to our speakers, and I'm a big fan of both of these individuals. Dr. Terry Fulmer is president of the John A. Hartford Foundation. She's a nurse and an internationally recognized expert in the care of older adults. She previously served as Distinguished Professor and Dean of Health Sciences at Northeastern University, and before that, she was founding dean of the New York University College of Nursing. We're also joined today by Dr. Ken Dychtwald. He's the founder, president, and CEO of AgeWave. Ken founded AgeWave in 1986 and has built it into an acclaimed think tank and consultancy. It's focused on the business, social, healthcare, financial, workplace, and cultural implications and opportunities related to aging and rising longevity. Ken is a gerontologist and psychologist by trade and is the best-selling author of 19 books on aging-related issues. I'm going to thank both of them right now for sharing their insights today, and more importantly, to each of you in the audience for being with us. Let me turn it now to Terry to begin our discussion. So Terry, I will turn it to you.
Thank you so much, Marcus. Thank you, Ken and the AgeWave team, and welcome everybody. I'm just so pleased to be able to share this information with you today and get your good thoughts. So we embarked on this project because we felt like we really needed a refresh on what older people are thinking about their healthcare today. And so we have learned a lot, and we really want to share that with you. As president of the John A. Hartford Foundation, as a nurse and as a 70-year-old, I know what good care looks like, and so do you. Well, good care is evident when what matters most to the patient is prioritized and respected and reflected in the care plan, and when the clinical appointment addresses more than just the illness and incorporates in the goals and preferences of the older adult. That's what we think of as good care. So our survey shows that what matters to older adults is often minimized, trivialized, or worse, ignored. And that just can't be what we think of as good care going forward. Not now, not then, not ever. There's often a disconnect between the care older adults want and the care they receive. And that's an even greater problem for underserved communities, for people of color, for women, for people in rural areas. This disconnect is something we can solve for. We believe that ageism is at the heart of the matter, and our culture has yet to appreciate and embrace the incredible longevity that has come with the science and technology that has just spurred so much innovation and improvement. But now is the time that we have to really think about what to do with that science, what to do with that innovation. We are at a crossroads. There are more people 65 years and older than there has ever been in human history. And so that is the greatest success story of the 20th century. But our data show that older adults are dissatisfied with what they perceive as complicated, confusing, and disjointed care in our systems. And they're afraid of the financial costs and potential errors that can occur in this period of time. And also, they're not really crazy about the allotment of 8 to 12 minutes for a visit, and neither are we. For too long, we've addressed patient concerns one disease at a time. And today we know that the data show that older adults want to be high functioning. They care about function. Maybe it's not their hemoglobin A1C completely, but they want to be functioning at the highest level possible for them. And they want to stay at home for as long as possible. So we need to really begin to have those at the center of the conversation. We asked Ken and the AgeWave team to explore with older adults what they're thinking, wanting, and feeling about the health, and to help us, because we all need to take action. It's not enough to do a survey. You have to act on it. You have to have measurable, achievable results. And we want everyone on this call to hold us accountable. As Ken will tell you, we heard that the healthcare system doesn't address the needs and concerns. I'm an optimist. I know we can. Older adults want age-friendly care. They want care that is evidence-based, reliable, and responsive to the goals and preferences of older adults. That's what we call age-friendly care. And we know that it's based in quality, safety, and reliability, and addresses what matters: medication, mind, and mobility, what we call the 4Ms. That set fundamentally takes you on a path of helping older adults get the care they want and need, and making sure you're maximizing their function, whether they are in a wheelchair or whether they are in any different stage of their life and well-being. So that set of 4Ms, what matters, medication, mind, and mobility, is something we really want you to imprint and take home from this seminar today. Thousands of hospitals, medical practices, pharmacies, and clinics around the country and around the world, by the way, are already working with our age-friendly care momentum. We call this our social movement, and we're very grateful to the Institute for Healthcare Improvement in Boston for their partnership, along with the American Hospital Association and the Catholic Health Association. But let me be very clear, age-friendly care is everywhere, no matter what location of care, no matter who's providing that care. And now is the time that we're asking you to join us and take a new path where care is focused on what matters most to older adults and is age-friendly by design. We want all older adults and their families to demand age-friendly care because they deserve age-friendly care. And this is the time. And we're very excited about the new CMS measure that's supporting an age-friendly hospital measure. We're very, very excited about that. We think that's going to really be a huge catalyst for change. So we hope this information provokes you. We hope it's the start of a larger dialogue. We want to empower you, the change makers on this call, the policymakers, the researchers, the advocates, to make age-friendly care a national reality. Older people deserve it. And thank you. Now back to you. Thanks, Marcus.
Thank you, Terry. It was a great setup, and you really have set the stage for today's discussion. And now I am really excited to have Ken join us to dive deeper into the findings from this really large, important national survey. So Ken, please take it away. We're excited to hear what you have to share.
Thank you, Marcus, and thank you, my friend Terry. We've got a pretty extraordinary turnout for this call, multiples of what we thought. And if you could see the list, as I did about 5 o'clock this morning, of who's on this call, I want to say thank you so much to have such an extraordinary cast of characters joining us. Here's the one request I'm going to make of you. As I do a quick kind of overview of some of the highlights of the report, and I encourage all of you to read the full report, I'm going to invite you to take a few minutes to put aside all the things you know, because we've got some real experts on the registered for this session. Put aside what you know and allow us to tell you what we've learned, and see if it doesn't perhaps reshape some of your thinking. Next slide, please. Thank you. First, there are some forces at play. Sure, they've been going on for a while, some of them, but they're lighting up right now. We had dinner with Terry last night, and we used the analogy of popcorn in the microwave. You know, it's been there for a while. We've been talking about the aging of the population for decades. You know, I wrote a book, Age Wave, 35 years ago. I've been working in the field now for 50 years, but look at what's coming. This massive growth in the number of older adults. And keep in mind that it's the boomer generation now who will be the older adults going forward. And they're not particularly stoic. They're complainers and they're also demanders. And they want what they want. Next slide, please. Another powerful theme. And I remember maybe around 1980, I was collaborating on a book with Jim Fries at Stanford, and he talked about the compression of morbidity. And that never quite caught on, but now we're hearing people talking about similar thing, that there's a gap between our health span and our lifespan, that we wind up spending, particularly women, over a decade, in case of women, 14 years with cascading health problems. And that's not what anybody wants. What people want is to match their health span to their lifespan. And then the big question is, are we doing that? Next slide, please, Connor. Check this out. And this floored me. We spend the most per capita on healthcare than any country in the world. And the out-of-pocket is extraordinary. I'll get to that in a little bit. But we rank 50th in the world when it comes to life expectancy. Horrible. And 68th in the world when it comes to health span. So no matter how hard Terry, myself, all of you on the call are working, we're not doing the right thing. And we need to stop thinking we are, and all we need is a little bit more of it, or making it accessible to a few more people. We need to create a much improved healthcare system to meet the needs of an aging population. Next slide, please. At the same time all that's going on, we're seeing people leaving the health force. We're seeing a growing shortage in nurses and doctors and caregivers, and that's never quite happened before. It was one of the things that we anticipated about the age wave, that at the same time you have more and more older people with health problems, you're going to see more and more health professionals, many of whom were boomers, men and women, leaving. Let me add to that. Get ready for this next one, please. Next slide. This one, we had a phone call among our team. We were stunned by it. Medical schools in America currently require, 96% of them require that every single doctor coming through medical school receive a rotation in pediatrics or some basic courseware. Only 10% require geriatric rotations. That is totally wrongheaded, totally unacceptable. We have an aging population. Older people are disproportionately the biggest consumers of healthcare. Get a load of this. The average out-of-pocket costs, out of pocket, that a couple will face from retirement day till the end of their lives for healthcare and long-term care is now $472,000. And to have a healthcare system that's not extraordinary in meeting the needs of older people is a profound mistake. Next slide, please. At the same time as these forces are changing our lives, there are breakthroughs in medical science. You know, I recently went through a bout with prostate cancer and I got treated with focused ultrasound. I know there's focused ultrasound people on the call. Took about 10 minutes for the whole thing. Zap, gone. No surgery, no incision, no chemotherapy. We're seeing breakthroughs that are coming along in terms of brain health. We're seeing extraordinary breakthroughs with CRISPR so that we might be able to write out of the body some of the conditions of the later years. And you might think, oh, that'll never happen. Hey, a century ago, diphtheria, cholera, typhoid, syphilis were the leading causes of death, and now we've rendered them to the past. And there are new technologies with regard to AI, whereby we might be able to gather up an individual's biometrics, make sense of it. Normally, what might take a doctor or a nurse practitioner hours to do, be able to do that in seconds, and then also provide a guide path for patients so that they know they're doing the right thing. We are at the brink of extraordinary changes. Next slide, please. So as Terry mentioned, we thought rather than speaking to political pundits or many of you on this call, healthcare or housing experts, what do older people think? Next slide, please. So really interesting. that we have ways of describing health and disease, and they're usually in terms of conditions. You know, you've got hypertension, you've got cancer, you've got dementia. Older adults have their own language. They say that health and being healthy is about being able to do the things you want to do. And you might think, well, that's a little corny. Hey, that's the way they think and feel. Keep that in mind. Next slide. I'm going to build on that. We ask people, when you think of a longer lifespan than your grandparents might have lived, you know, I'm 74 now. My grandparents were in their 70s. They truly felt that they were, you know, at the finish line. My wife and I, you know, we might have 2 or 5 or 10 or 20 more years in our lives. People say that the number one things that are appealing about longevity are enjoying more time with family and friends and continuing to do the things that I love to do. Keep that in mind. And you might think to yourself, if you were to be able to live a longer life, why? Why would you want that? And this is what people are telling us. Next slide. There's also some worries. And, you know, often you try to be a good guy or tell the truth or bring up some of the issues. People said their number one worry was losing the ability to think clearly and becoming frail. And the frailty, and that's a word we're going to hear more and more of, is not only, you know, a third of the elderly fall each year, and they may break their hip or they may have a broken bone, but frailty could be psychological, emotional, spiritual. Connor, next slide, please. Now, this was extraordinary. We asked people, not government workers, not gerontologists, geriatricians, what's the most feared condition of later life? Number one, not even close. Alzheimer's and dementia. So I was a lucky man. When I was around 30, I collaborated on a book with Dr. Jonas Salk. And one night over dinner, Dr. Salk was explaining to me how in the 1940s, when poliomyelitis was rampant, people were thinking, boy, we're going to need a lot of iron lungs in the future. And Salk took a different point of view. No, he said, we have to wipe this disease out, and I don't want to earn $1. Many of the conditions that older people have, we in the health or gerontology fields don't often think of breakthrough scientists as our partners. But if there was a breakthrough, and I read about them daily, literally daily, from one part of the world or another, so that we could live our lives with brain health, be a whole different future. And all kinds of care wouldn't be needed. Next slide, please. This one floored us. We asked the older adult population, how do you feel about the healthcare system overall? And I know we've got central figures in the healthcare system on this briefing. Would you give it a good grade? Would you give it an A? Only 11% of older adults give the overall healthcare system a grade of an A. That's not good news. That's a wake-up call. And so if we think what we're doing is great and people really appreciate it, we could do better. Next, please. Let's build on this. Terry mentioned earlier, and we probed, what are the kinds of things that people want their health professional, whether it's a physician's assistant, a nurse, a doc? Well, ask me about how I'm doing relative to medications. And keep in mind that the average older adult takes 4 medications a day, but 17% take 8 or more. Also, understand what matters to me, not just what's the matter with me. This turns out to be a really core theme. Doctors are in a hurry, nurses only have so much time. There's parts of rural America where people can't even find a hospital to go to, or a healthcare professional, or it might be a 3-month wait, and then they're kind of, you know, moved in and moved out. Older adults want their health professionals to know who they are, what matters to me in terms of my family, my grandkids, my spouse, living alone, what am I frightened of, and what matters to me in terms of my well-being. pay attention to my mobility. And we asked, only about 55% of people said that their doctors were paying any attention to their mobility. And then we took mind and split it into mental health and brain health. And then when you add them all up, what percentage of people say that their health professionals are checking about these 4 M's? Only 19%. So when Terry says we've got to create an age-friendly healthcare system, it's not like we're close. There's real work to be done. And every one of you on this call has got to think about, how do you build the momentum? And the age-friendly healthcare system not only includes doctors, hospitals, nurses, physicians, assistants, and associates, and nurse practitioners, it includes housing. You know, a third of the elderly fall each year, often in their bathrooms. We haven't designed our homes to be age-friendly. Stairs and steps, not designed for an aging population. And I could go on. Next slide. So what are some of the solutions towards a healthier future? Connor, please, the next slide. You can't get 94% of the American public to agree on anything. Yet 94% of older adults agree that healthcare providers should be trained on the unique health issues of older adults. Now, I'm about to offer a Ken Dychtwald opinion. This is not AgeWave or John Hartford. I don't think Medicare ought to be compensating health professionals if they haven't gotten a basic credential or certificate that they've learned the core issues of dealing with older people. The fact that we're just keeping our fingers crossed and hoping that people decide they want to learn more about aging and older men and women, I think that, you know, time's up. We need to create a standard. I know the people at John A. Hartford have got some things in mind, and we need to have it sweep the country, or else people won't get paid. Next, please. This was interesting. There's a lot of, you know, buzz in the media about one group and another group, and they have totally distant and different views about everything. Well, we found that when we split out, thanks to the help of the Harris team, Democrats, Republicans, and independents, there was massive agreement, sort of incredible agreement. You know, everybody's got a mom or a dad. Everybody might feel their knee hurting a little bit. Everyone is worried about their brother or sister. That making healthcare more affordable was overwhelmingly a high priority. And, you know, we've seen in the run-up to this particular presidential moment, and I've watched every presidential debate for the last 20 years, there's talk about getting access to healthcare to people, but there's not talk about having it be affordable or even having it be effective. And people really want the prescription drug costs lowered. My wife and I, Maddie and I, were watching a piece of 60 Minutes last night, and they talked about a medication that in France was $7. The exact same medication was $500 in the United States. Hello? Next slide, please. In a few minutes to go. This captivated me. We would imagine that what people want from their health professional is knowledge and competence. No question. And as I mentioned, they want you to be more competent when it comes to dealing with the needs of older adults. And as we know, only 1% of the health professionals in America are geriatricians or gerontologists. 1%. But they also, this is a repeat, they want a health professional who listens to them, who's not just looking at their computer or is not just reading data, and respects them. They feel the absence of respect and they want it stopped. And keep in mind, by the way, that the average older adult sees multiple doctors each year. In fact, 30% see 5 different doctors, and they often don't talk to each other. And so it's left to the 72-year-old or the 84-year-old to try to figure out what their different doctors are saying, create some overlap, and create a path forward. That's outrageous, not acceptable. Next slide, please. And remember, what we're trying for is health span to match our lifespan and saving trillions of dollars. Now, this was interesting. We pulled out of our sample people who were receiving age-friendly care. the basics, the 4 M's. And it turns out that those folks, whether they were rural or urban or Hispanic or white Americans, or they were healthier, they were happier, they were more satisfied with the healthcare system, and they were rating their prospects for future health more favorably. So it works. A couple of more slides. Now, I throw this up here just to kind of offer a kind of a sparkling point, which is that there are breakthroughs, back to the idea of popcorn in the microwave. There are breakthroughs coming from everywhere. CVS has got mini clinics. Right up there next to CVS is ACL, Administration for Community Living, is currently creating a brilliant master plan for the entire country so that we can do a better job engaging and respecting and creating health for older adults. You know, Mark Cuban is creating a less expensive pharmaceutical offering. ChatGPT is now turning its attention to health and well-being. Amazon is attempting to create a smarter, less expensive healthcare system, and I can go on and on. That more and more companies, not-for-profits, and government groups are beginning to see that the aging of our population is a substantial phenomenon, and the terrible degree to which we are causing older people to be as healthy as they can possibly be for as long as possible is cause for serious attention. So let me tie this all together. We are clearly at a crossroads. And, you know, some of you might say, well, I know a number of you on the call, we've been in this field for 30 years, 40 years, 50 years. I've been talking about this for a long time. But the amount of attention, the amount of media, the demographics, the potential breakthroughs, the movement is creating an awakening. Today's older adults are redefining health and aging. They appreciate the idea of a longer life, no question, and they worry about what kind of longevity they're going to have. Second, our healthcare system is facing totally unprecedented demographic pressures. 2/3 of all the people who've ever lived past 65 in the entire history of the world are alive today. Urgent actions are needed to create an age-friendly, let's use that phrase, where there are now thousands of age-friendly hospitals and clinics and community centers, and they want to have their lifelong health and well-being supported. And I would argue that we shouldn't just focus on the aged, we should help everybody as they grow older. Imagine a future where they're a healthier version of themselves. Older adults want, and they're tired of what's going on. They want their healthcare providers to be aging competent, to take more time to understand what matters to them, and to partner with them on all healthcare decisions. Next. There are breakthroughs on their way. Some are you can read about today, and some, you know, we track them. Are coming in the next few years. Scientific breakthroughs and digital AI breakthroughs could eliminate some diseases in order to better match our health spans to our lifespans. And finally, more health, lower cost. The amount of money that our government spends, you know, Medicare was 3% of the federal budget in 1970. It's 17% now. And the out-of-pocket for older adults in terms of their home care or in terms of their health care, in terms of their long-term care, is destructive to family financial well-being. So let me go back to Marcus and Terry, and let's see if we've got a few questions.
Ken, thank you. Thank you. And I know for you and your team, really diving deeply into and asking questions that really matter to older adults about their health and healthcare, and then reflecting and giving us just a snapshot. And I do want to encourage everyone to check out the full report because there's so much more data there that you can use. I'd like to now turn it back to Terry for her reactions to the research, what you just presented, and that will lead us into a conversation. And so I do encourage everyone to continue chatting in questions at the bottom of your screen. Terry, over to you.
Thank you, Marcus. And as usual, Ken's inspirational. You know, we have the knowledge, we have the capacity, now we need to get busy. And so I thought it'd be helpful if I just share with you a couple of cases going on in the United States where we're seeing this notion of using a 4M set make a difference in healthcare. So, for example, Providence St. Joseph Health in Oregon, once they began to use a 4M approach where they were really screening for fall risk and cognitive impairment changes and really focusing in on what matters to the older person, resulted in a 7% decrease in hospitalizations. That is enormous. And it's most important in terms of the time it gives back to older people and their families. Think about family members you have when they're in a hospital, they are not where they want to be. And as a nurse, every single patient I ask, I say, you know, what's your goal today? And they tell me, I want to get out of here. So giving that time back is critically important. Another Rush University Medical Center found that patient satisfaction scores have risen above the national average, 79% to 84%. That gets heads turning. So if you look at the American Hospital Association website or IHI, there are multiple cases because each of you need to make the case to your organizations, to your families and friends about why this is so very, very vital and important. So I think that what we know is that older adults really want people who will listen to them. Now, as a clinical nurse, I understand that we are rushing all of our clinicians to get their job done faster, faster, faster. It might be time to say to everybody, wait, if we just pause and if we just provide a meaningful exchange around what matters, we can meet the triple aim. We can improve the well-being of older people. So I think that I also want to point out there are multiple resources on the web pages at IHI, on our web page, and Marcus will chat those in, and also on the American Hospital Association. You don't have to do this by yourself, and you don't have to start from scratch. We have lots of strategies that can help you. I am very concerned that our survey exposed inequities for older adults and from marginalized communities. I know that we can change this. We can fundamentally change this. And when we see glaring deficiencies in care, we have to act on it. And we have to figure out how we can help people, no matter who they are, make sure that they are getting the care they deserve and need. And as disturbing as it is to me, I know it's disturbing to all of you. I really love the National Plan for Aging, and Ken mentioned it, and thank you to ACL. You know, what we know is that that's really going to sweep the nation. And so with that successful national plan, we'll also need to consider how we finance long-term care. And I'd like to give you an example of one long-term care facility that found what 4M Care did for them. And that is when we were talking with the Banner Health and really thinking about with them what needed to happen in terms of improving their care, we found that their satisfaction went up, the length of stay went down, and the number of falls decreased. Isn't that what we want? Because let me remind you, you can, I'll say the obvious, you can do a valve replacement on somebody's heart, but if they fall the next day, or if their post-anesthesia confusion creates an injury for them, we will have gone backwards when that scientific miracle of heart surgery was what they needed, but not what the outcomes suggested. So I think that, you know, just pulling together and saying, let's work smart. Let's reduce our cognitive burden. Let's work on an approach that matches also with what's going on at the WHO, at AARP. We're talking about age-friendly cities, age-friendly communities, age-friendly public health systems with TIFA. Well, I'm here to say you cannot be an age-friendly city if you don't have an age-friendly health system in your city or in your community. So I challenge all of you to join us, to push this, to make a difference in your communities. So those are my immediate reactions. And I think AgeWave research really highlights what the American experience is with regard to frustrations, challenges, and worries. But I'm heartened because I know that we have the tools and ingenuity to respond in a way that will make a difference for everybody. So back to you, Marcus.
Thank you, Terry. Those reflections were really important and I think are a great launching point into some conversation and dialogue we can have. So in that spirit of let's get busy, let's begin that conversation. And reminder again to everyone, you can put questions into the Q&A box at the bottom of your Zoom window. But let me start with a question for you, Ken, because we have some folks on the line, as you mentioned, who have known you for a long time, and you spent decades studying various aspects of longevity across sectors. In this study related to healthcare, was there anything that really surprised you that came out of those findings that you presented, or was this all expected to you?
There were a few things, thanks, Marcus, that surprised me. One, how outrageously expensive our healthcare system is, that it's become sort of a profiteering frenzy, and the abysmal level of health it's producing. Now, don't take this personally necessarily, everybody on this call. You know, I know we've got Louise Aronson on this call. You know, there is not a better geriatrician in America than Louise. We've got Bob Kramer on this call, who's done more to promote, you know, age-friendly housing than anybody I know. We've got all sorts of people on this call. So it's not to say that you are not doing a great job, but the system itself is more inadequate and more off point than I was expecting it to be. It was worse when only 11% of the older adult population gave a good grade to the healthcare system. I thought, what? Another thing that concerned me, and Terry mentioned it, I never had really thought as much about the inequities. That, first of all, if you're rich, you can get your way to a concierge doctor, or you can get access to a good healthcare system, or you can get attention. But if you're modestly resourced, you're in trouble. You might not be able to get an appointment. You might not have a health professional who will meet with you for 4 months. And I thought, wow, women. And then another one, women. Women live 5 to 6 years longer than men, but they wind up, even factoring for that, with more health problems than men. And the realization that our healthcare professionals have largely not learned about women's aging and women's health. And also the fact that women are more likely to be solo, to be living alone in their later years. So who's going to look after them or help them with their medications? I was confirmed, but also jolted when I saw how cognizant the public was about how terrible brain health or Alzheimer's and dementia were. And if you look at the Gates Foundation, they say that somebody with dementia spends 5 times the dollars on healthcare compared to somebody who's not. And I want to point out a little piece of our study that came out that last year, for the first time in the history of America, probably the world, more workers were caring for a parent or a spouse than a child. So childcare, which we've lived in an era where we've been increasingly respectful and sympathetic to childcare, guess what? What's about to emerge is a realization that elder care is a serious challenge. And last, I would say, Marcus, that the challenge in rural areas, as we're seeing hospitals shut down, people can't find a health practitioner. They have to wait 2 days. There are communities where 911 is no longer functioning. And I thought, we think of ourselves, I do, as the greatest nation on earth. And we must be doing a better job with regard to providing health care, health information, health education, and navigation to older men and women who are getting lost in the shuffle.
Yeah, the navigation is so important and came out loud and clear in the survey responses, right? You also hit on a couple of other questions that have come in, Ken, so great job. We had a question about women's responses to the survey and how they were different, so thank you for covering that, as well as some of the issues related to rural older adults. We're also getting lots of comments and questions related to this focus on what matters to us as we are older and in our healthcare encounters. And so, Terry, I do want to come to you because this is a major part of our work together at the foundation. But we show that what matters to older adults is often minimized or worse ignored. That's what you said, your commentary about the findings. Tell us why meeting patient goals and preferences is so important. Do you see healthcare shifting to be more focused on what matters as we age? And then I'll add in and ask a follow-up question about that measure you mentioned earlier. Ooh, and you're on, yep, thank you, Mary.
Thanks, Marcus. This generation of older adults is acutely aware of the care that their parents are getting and what they're seeing, and they have very strong opinions about what they want for their own care. This is a time when, like never before, that we've needed everybody to have their advanced directive in place. They've needed to have a conversation with their clinical team about what they want in the event that their heart stops, in the event that they have a brain event, and anticipating, talking about hospice, not as something to be feared, but as one more tool in the toolkit, understanding the difference between hospice and palliative care, for example, and understanding what they want from their long-term care. And we know that when during COVID, we worked so hard with so many organizations in this nation and around the world to figure out how to help that system, which has been abandoned, frankly. And, you know, we have 1.2 million people living in nursing homes and many more passing through, probably 4 times as many passing through. But yet we tolerate bad care and lower staffing and inadequate, as well as salaries that are not equitable. If I'm a nurse in a nursing home, I immediately make less than if I'm a nurse in a hospital, simply because that's the standard that we all have agreed to accept. Well, I don't think that's appropriate, and I think we have to begin a national conversation about that. So what matters to older people is your point, Marcus. And what we find is that if when you ask that question, you get a better care plan, you improve outcomes, and you improve satisfaction with care. So back to you.
It's terrific. And Ken, please jump in on that and
Let me
unmute yourself.
quickly jump in on a couple of points that Terry astutely made. One of them was that 92% of the people in our study felt that they wanted their health professionals and their family to understand their preferences for how they want to be cared for towards the end of their life. But only 53% of them had written that down. So there's a kind of an intention action gap, and people have got to be helped to think about and to plan for issues. The other thing was that 95% of people wanted to be cared for at home. The nursing homes during COVID became a little more terrifying to folks, and there may be well-intentioned people working in these facilities, but people said, you know what, if you can bring the care to my home, whether that's telemedicine or telemonitoring or doctors at home, and we've got examples in our report of how people are doing that now, nurses at home, caregivers at home, that's what people are telling us they want. They want community and home-based care, not so much the nursing home care, which is what people in a previous generation may have thought was the answer.
Great points. That disconnect, right, that we saw over and over again in the survey between what people want and expect and what they're actually getting. And so that's in the nursing home setting, as Terry described, needing reform and helping people age in place. And our foundation supports many initiatives about home-based care. Terry, I do want to mention the important role of hospitals as well in keeping people at home and out of nursing homes if that's their choice. And it was mentioned earlier, and people have chatted in information about this new measure that the Centers for Medicare and Medicaid Services have introduced. And just a quick setup, that is called an age-friendly hospital measure. It is for all hospitals in the country that participate in the inpatient quality reporting program, special program of Medicare. And that's almost all hospitals. And they will now be required to document and say whether or not they are aligning care with people's goals and hitting on all 4 M's. And Terry, I just wanted to get a quick comment from you about, do you see that as something that can move the needle at all as we move forward?
Thanks, Marcus. And I think that it will really help the healthcare system do what they fundamentally think is right anyway, but it provides incentive, it provides finance, and it provides all the different ways that affirm and confirm that this is the right way to go. This is about, as Ken has said, adding quality to the extra years of life. So we are very excited about it. It starts January 1st. We know that all of you will be taking a look at that, and we will have lots of resources for you in order to meet the different components of that measure. And we look forward to doing that. It's a huge step forward for us. We could not be more excited about it. And I'm going to just add one more point, which is a part of this entire dialogue, and that is what we're talking about today is a part of support for family caregivers. We know we have 53 million family caregivers out there right now who are saying, what do I do now? We send people home with tube strips and drains, with very complex care needs. And these individuals, as Ken pointed out, balance their jobs and families with taking care of older relatives without formal support. So we really need to make sure that we are attending to that as well. And I think the National Plan on Aging is going to do a great job with that. Back to you, Ken.
Yeah, I want to add one other thing, and I feel a little embarrassed to admit this, but I've worked in the field of aging now for 50 years, written 19 books, I've got a PhD, blah, 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 blah. But when I qualified for Medicare, I did not understand it. Part A, Part B, Part C, Part D, donut holes, what's included, what's not. Never understood that dental, vision, and hearing were not included. What's that about? I know Larry Curley is on the call, Navajo elder. And I was with Larry at a gathering of 1,000 Indian elders a couple of years ago, and many of them had no teeth. And it never struck me that, wow, what does Medicare cover? A lot of people think Medicare covers long-term care. Doesn't, unless you're such a modestly resourced zone, and then they might place you in a nursing home. So how do we create a Medicare where we cut out the nonsense, and so the average person can understand what's included, what's not, can know what they're getting, and then can talk about how to reshape Medicare to be better aligned with the needs of the aging boomer generation and their families?
Thank you. Thank you both. And we have time for a few more questions. And I should have said that your questions are also serving to inform our future communications back to you. So never fear, we're not going to be able to get to all of them, but I should have said they're going to be incredibly valuable for us as we move forward. So thank you. I do want to go to a question. We've had a couple now about, Terry, you mentioned family caregivers, which is coming up in the Q&A a lot, but also we're getting questions about what about people who don't have family caregivers? So what about older adults who do not have children or close blood relatives to be active participants in their care? It seems our current model assumes that will be the case. So what can we do to help contribute to their better care of those older adults who may be living alone? Terry, can I start with you and then go to Ken?
Sure. Thanks, Marcus. We know that some states, and I believe it's Washington State, that's begun to provide dollars from their state government to people who are helping with caregiving. That's powerful, and we hope that that becomes a norm as well. And maybe we can find a link and chat that in either now or make sure everybody gets it. I think that for those people who don't have families, where are we seeing innovation? The Administration for Community Living, the AAAs are trying to reach out. The use of telehealth is a powerful way to decrease social isolation, which we know the Surgeon General really reminded us that it is a very dangerous thing to be socially isolated if you're an older adult, and it can lead to injury, can lead to substance abuse, can lead to mental health concerns. So we need to make sure we get to everybody who is potentially without a family caregiver or a friend caregiver. We've seen churches and synagogues and mosques all help, all the different religions and different ways in which faith-based organizations help older people. We also are seeing community health workers through our public health system, which needs enormous support. A shout out to everybody in public health who continues to do yeoman's work when in fact, what you really need is a tripling of your budget. to make sure you're doing what you want to do. So I think that to put a point on it and then let Ken add is to say that there's multiple sources of individuals who are willing to help, but we need to make sure that they're being compensated or covered for that added support. Ken?
Yeah, I would add one other innovation, and it harkens back to a futuristic TV show from the 1980s. And no, it was not the Jetsons, it was Golden Girls. The idea of people having housemates and roommates and looking after each other and picking up the groceries for one of your housemates or playing a role in their life. Maggie Kuhn, one of my mentors, the founder of the Great Panthers, shared with me decades ago that we've gotten too carried away with independence. And we would be better off as an aging society if there was more interdependence in the way we lived, in the way we shared, in the way we looked after each other in our community. So I want to add that in too, as not so much a tech or a systematic innovation, but something that people might contemplate in their own homes.
Yeah, a further point, excuse me if I may, Marcus. We have thousands of people who are homeless and they're growing older. We have thousands of people in prison and they're growing older. No matter where you are, no matter who's providing the care, we have a societal responsibility to get to those individuals and make sure that they're getting quality, age-friendly care and that they are not abandoned.
A third of the homeless population is now over 65. I was just told that last week by the Justice and Aging folks. We should be ashamed of ourselves.
Very important topic, and I'm so glad you raised it. And again, you're hitting on lots of questions that have come up in the chat related to housing models, and Ken, you're kind of touching on that. And I would suggest maybe there are ways of systematically building up supports for people to co-share housing and get credits for that and help push that forward. I'm going to kick this up a level to you because we're coming quickly to the end of our time here. And I want you both to respond to this great question we got. So if you could deliver one message to our presidential hopefuls on this topic of age-friendly care and what older adults want from health and healthcare, what would you say? Can I begin with you, Ken?
Yeah, this is my psychosis. I would say two things. Number one, the issue is not just making healthcare accessible. The issue is making healthcare excellent. And so there's tuned into what matters to people, it's tuned into the problems of an aging population, and it's respectful and concerns itself with what matters to people. And the second thing I would say is that we've got whatever it is, 70 million retirees. Last year averaged 47 hours of television watching a week, only 28% volunteer. I think that the next president ought to dream up a kind of an elder corps, like a Peace Corps, whereby older adults can play a more active role in their families and their communities and in life at large, and thereby also improve their health and well-being and their sense of purpose.
Terry, can I go to you?
Sure. I would add that, the National Institutes of Health, and in particular the National Institute on Aging, have done an extraordinary job generating the science that we can use to improve care for older adults and improve care for everybody, by the way. So I think that what I would say to the next president is that we have good science. What we have is an implementation failure, and that may be with the future of AI and with the future of the improvement of electronic health records, from billing systems to patient care systems, all of that might begin to sort itself out. But right now, I want to thank all of our government workers who toil tirelessly every day and to do the good work that needs to happen, no matter against enormous obstacles. It can be very challenging to be a government worker. And in my job as president of this foundation, I have seen people work miracles from their desks in Washington. And so I want to thank them for that. I also want to do a shout out to the VA that has done an extraordinary job in really focusing on better care for older veterans. Thank you for that incredible service. And so
Agreed.
what I would say to them is use your experts, go to your experts and count on them, and make sure that we are accelerating the use of the knowledge, skills, and implementation science to improve care now.
Good message. Good message.
I want to
President.
add, speak out to everybody on this call, and speak out to the folks in your local and national media who are not covering these issues sufficiently. It's not part of debates. It's not a part of what people are being asked when they talk about the future. And we must create a healthier version of aging and longevity.
Thank you both. Those were tremendous reflections based on what we heard from real older adults across the country, a nationally representative sample, 2,500 respondents who shared with us the challenges they're facing and led us through the other research that AgeWave has done into finding solutions that we can all act upon together, all of us. So I do want to begin closing us out now. And I want to say thank you, Terry and Ken, for your
Marcus.
reflections and for all the work that you've done to spread the word about the need for age-friendly care. I want to mostly thank, though, our audience for participating in this discussion. We so appreciate your time and interest in creating a more age-friendly healthcare system and a more age-friendly world. We will provide a recording of this discussion and links to resources that have been mentioned, and we'll send that to you via email. We're also going to really look carefully at all the questions and comments we got to help inform our work as we move forward. So I want to say thank you to everyone. Please have a good rest of your day. We look forward to working with each and every one of you to improve the lives of older adults. Please use our report. Have a great day. Have a great time helping us all make care more age-friendly for all of us as we get older. And with that, we'll close out the webinar.